Hello everyone, my name is Srilekha. In this video, we are going to discuss about human disease caused by bacteria, virus and fungus.
First one is tuberculosis.
Tuberculosis, also known as TB, is a bacterial disease caused by Mycobacterium tuberculosis. It primarily affects the lungs, then spread to different parts of the body. 30% world population have latent infection. Latent infection means no symptoms appear. 10 million people with active infection. Active infection means symptoms appear. 1 million death per year. Mycobacterium tuberculosis is a slow-growing bacteria, rod-shaped, non-motile and with lipid-rich waxy cell wall. Mycobacterium tuberculosis was first isolated by Robert Koch. Transmission. The bacteria that cause tuberculosis are spread from person to person through tiny droplets released into the air via cough and sneeze. The primary site of infection in the lungs known as the gonfocus. Tuberculosis of the lungs also occur via infection from the bloodstream. This transmission can also spread to other sites such as the brain, the bones, peripheral lymph nodes, and the kidneys.
Risk people, healthcare workers, person with diabetes mellitus and HIV. HIV weakens a person's immune system, so it can't fight the TB germs. Diagnosis, sputum culture. It is a positive confirmed TB test. The Mantoux test is a widely used test for latent TB.
Sign and symptoms. Latent TB, no symptoms. Active TB, symptoms appears. Symptoms include fever, fatigue, chest pain while breathing or coughing that lasts 3 or more weeks, clubbed fingers. Treatment. Treatment for tuberculosis usually involve taking antibiotics for several months. Prevention. TB vaccination, wearing mask, covering mouth, strengthen immune system, maintenance of hygienic condition. Next, pneumonia. It is an infection of the lungs characterized by inflammation of air sac in one or both the lungs caused by various bacteria, virus and fungi. The air sac gets filled with fluid or pus resulting in fever, chills, cough and breathing difficulty. Bacterial pneumonia. It is caused by Streptococcus pneumoniae. It is a round bacteria growing chains, gram-positive bacteria and non-motile. Symptoms. Coughing with greenish, yellow and sometimes blood in the mucus, shortness of chills, fever with chills and chest pain. Diagnosis. Physical examination, blood test and test for sputum. Then chest x-ray. Treatment. Treatment options include antibiotics, oxygen therapy for breathing problems, medicine for pain and cough relief. Prevention. A few types of pneumonia can be prevented by certain vaccinations. Practice proper hygiene. Avoid smoking and alcohol consumption. Next is bird flu. Bird flu is a viral disease of birds. It is a very serious poultry disease, causes high mortality in poultry birds. The disease is caused by avian influenza A. It is a DNA virus. It is also called H5N1 virus. Most bird flu virus can only infect other birds. Humans catch the disease through close contact with live infected birds or bird droppings. Human to human transmission is also very rare. The disease in human was first reported in 1997 in Hong Kong, where 18 people were infected and 6 people died. Symptoms of bird flu. On man, coughing, fever, sore throat and itching muscle to eye infection and more serious pneumonia. Treatment: use antiviral flu drugs, Tamiflu, Relenza, etc. There is no vaccine for avian flu. If you work with poultry, make sure to have your birds tested regularly and take all necessary precautions when working with them. Thoroughly wash your hands with soap and water. The virus gets killed in heat. The egg should be boiled for more than 5 minutes after proper washing the outer side. Next is SARS, Severe Acute Respiratory Syndrome. SARS first appeared in China in November 2002. Within a few months, SARS spread worldwide. SARS is caused by a strain of coronavirus, the same family of virus that cause the common cold. How SARS spreads? Spread through droplets that enter the air when someone within the disease cough, sneeze or talks. The virus may also be spread on contaminated object. Symptoms: fever, dry cough, shortness of breath, muscle ache, headache, diarrhea, vomiting, sore throat. Complication: many people with SARS develop pneumonia and breathing problems. Can become so severe that a mechanical respirator is needed. Then heart and liver failure. Then people older than 60, especially those with underlying conditions such as diabetes or hepatitis, are at the highest risk of serious complication. Risk factors. In general, people at greatest risk of SARS are those who had direct close contact with someone who's injected, such as family members and health workers. Prevention: wash your hands, wear a disposable gloves, wear a surgical mask, wash personal items. Diagnosis: antigen test, RT-PCR test, serologic test. Treatment: no uniform treatment for SARS-CoV. Vaccine, quarantine and isolation, require intensive care and observation, antibiotic to treat bacteria that cause pneumonia, oxygen, breathing support, then chest therapy. Next is Candidiasis. Candidiasis is a fungal infection of the skin, mucosa and internal organs. The main causative organism behind the infection is Candida albicans. Candida albicans is normally found in skin, gastrointestinal tract, oral and vaginal cavities. Candida albicans is a spherical yeast cell. The important species of Candida found in the human body are Stellatoidea, tropicalis, cruzi, galbrata, etc. These fungi live on all surface of our bodies. Under certain conditions, they can become so numerous they cause infections, particularly in warm and moist areas. Risk factors: people with a metabolic disorder, including diabetics, HIV, then pregnant women, then overweight people. Oral candidiasis. The spread of the candida yeast in the mouth and throat lead to a condition called thrush. Redness in the mouth and throat, white or yellow patches on the tongue. Genital yeast infection. When the yeast spread in the genitals, it is referred to as genital yeast infection. Women are most affected by the genital yeast infection than men. Yeast invasion of the vaginal mucosa lead to vulvovaginitis, which is characterized by irritation, vaginal discharge, pain and burning during urination. Candida invasion of the nails around the nails plate causes onychomycosis. Mild case white spots, severe cases yellow, brown discoloration, permanent damage to the nails. Then swelling. When the yeast enters the bloodstream and spread to the other part of the body, kidney, spleen, bones, muscles, joints or eyes. It is called invasive candidiasis. Diagnosis include tissue biopsy, antigen test, specimen collection by skin scraping, nail scraping, sputum, urine and blood. Treatment. Removal of predisposing factors. Imidazole can help to reduce superficial infections. Use antifungal drugs. Use antifungal cream and powder.